I'm also the Vice President of the Douglas County Board of Health. Many people have asked me, why are you sitting on this board? And I think it's important that the taxpayers understand that we are going to be very fiscally responsible with this new health department as we provide services. I have a strong background in finance. I have a finance degree and MBA. I have managed large budgets at the Colorado State Patrol. As the coroner here in Douglas County, I sliced the budget by a third, and I've been helping look over the budget here in Douglas County for the last 5 years. So know that while public health is our focus, we are also going to be watching the finances in the department. Thank you for listening to us this evening, and we hope you bring a lot of great questions to our discussion. Thank you.
Just to introduce myself, my name is Chris Pratt. I'm a Senior Assistant County Attorney here in Douglas County. I have been assigned to help the new Board of Health with their legal questions and concerns and issues. And so I'm here tonight to answer any questions that I might be able to.
And I'm Barbara Drake. I'm the Deputy County Manager here in Douglas Health Department.
Good evening. I'm Tom Butts. I'm an environmental health consultant with prior experience working 27 years for Tri-County Health in the areas of environmental health, emergency preparedness, and administration. I've also worked as a local consultant for 5 or 6 other local public health agencies along the Front Range in Colorado, and I serve on the State Board of Health.
Hey everybody, George Teal, Douglas County Commissioner. I'm also the Secretary of the Douglas County Board of Health. I want to say thank you for everyone who is joining today, those of you that are here in the audience, here in the chamber, but also everybody joining on the internet and joining on your phones. Thank you so much. This is such an exciting, interesting, fascinating process that the county is about to embark on. The opportunity to create a customized, if you will, public health department for our county, governed by residents of Douglas County, with a health department for the people of Douglas County. So thank you very much. We're very interested in hearing from you today. I hope you'll call in. I hope we have people raising their hands here in the audience. And thanks for coming.
Hi, everybody. Abe Layton, Douglas County Commissioner, and it is just an honor and pleasure to be with all of you here in person, and then also all of the wonderful folks online. Thanks to everybody who braved the potential storm tonight, it sounds like, to be here and ask your questions. I will tell you, I am thrilled to death to be here because the focus in Douglas County is on transparency and accountability. We always say we work for you, not the other way around. And so tonight, it's really about your voices, your personal lived-in experience, your questions, the issues that are important to you as it relates to public health and that service delivery in Douglas County. I am really honored and pleased that we are now the 50th of 64 counties in Colorado that have their own local public health department. It's not a new animal. Obviously, 50 is pretty high, but it's probably overdue that this occurred. We have 357,000 people, probably too big to be small. So I'm really thankful for this Board of Health, as well as the experts represented tonight that are here to answer your questions, good, bad, ugly, everything in between, and to continue to provide that transparency. This is the 30th live town hall that we've done, and probably the first in this format. So it's a lot of fun to be here with you. Thanks for being here.
All right. Again, this is Roger, your moderator tonight. I'm sorry if we had a little technical difficulties right at the beginning and you could not hear me. So I'm going to take just a quick second to tell you again the format about tonight's interactive call. We do want this to be very interactive, so if you'd like to ask our panel a question, please press *3 on your keypad, and you will be transferred to an operator who will take down some basic information. Once the operator notes your information, you will be returned to the call and can listen to this conversation until you are called upon. So again, please press *3 on your keypad to ask a question. Since our panel does want to hear from as many folks as possible, we'll ask you to limit your questions to just one. And when it's your turn, I'll call out your name and ask you to repeat it for our live audience. So why don't we get the conversation started by going to an online question first from Robert. And here is that question. Robert asks, if Tri-County Health Department dissolves because of the secession of the counties, won't Douglas then be stuck with building its own health department for millions of dollars? Who'd like to take that?
Well, my guess is all of us want to take that. I don't sit on the Board of Health, but I know our Board of Health is ready and able to answer that question. I think the first response is thinking about the premise. There's no reason that Tri-County Health has to dissolve. In fact, they can be their own independent public health services provider in the metro area to whatever counties, municipalities want to contract with them for those services. We clearly have an IGA with Tri-County Health to provide some services that are relevant to Douglas County. That may change over time, but at this point, we don't foresee any deleterious effect to Tri-County Health unless they choose to walk down that path. I'm sure others have more to say.
So I'll add that we just learned this afternoon that Adams County will be leaving Tri-County Health as well. But they have to give a 1 year's notice. So we know that Tri-County is going to be around for a while. They have an agreement with us to provide services. And I think there is a great opportunity, like Commissioner Layton said, if Tri-County wants to, they could continue to provide services in different formats. We need people who are experienced at inspecting restaurants, at septic system inspections. We have land use questions that come before us that Tri-County weighs in on. So there's still a lot of opportunity for Tri-County to remain a viable organization if that's what they choose to do. Commissioner Teal?
Yeah, thank you, Laura. I mean, I appreciate the question because it's actually a very important one. And I have to say that I look at this as a big opportunity. From my perspective, we've been heading down a path to have some services possibly provided by Tri-County, but substantial services provided here within Douglas County by a Douglas County Health Department. And so I realize the phrase was stuck with providing services. I see that as an opportunity, though. I don't see us being stuck with anything so much as having the opportunity to decide, well, what do we value from Tri-County? What are the valuable services they provide versus what are the services that, quite frankly, we would rather be doing here in-house, here in the county, and perhaps even do better because we know our county. So I, for one, look at it as a very exciting process, opportunity to tailor-make a department, a service, just like we do right now with the Douglas County Sheriff's Department, just like we do, as Commissioner Thomas mentioned, with the coroner's service, the coroner's office here, just like we do with our own internal planning and our Health and Human Services Department. So I look at it as a real opportunity. But thank you for that question.
Thank you, Commissioner. Again, if you'd like to ask a question, please press *3 or make a comment live and send your question through the website at douglas.co.us/town hall. Let's go to the phone line now and ask Thomas. Go ahead with your question. Thomas, you are live on the call. What's your question?
My question was, has anyone done a study estimating the cost of establishing the Douglas County Health Board, and where are we going to get the money to pay for it?
Barbara?
Oh, man.
Sure, this is Barbara Drake. And so this is one thing that we're working on, along with many other different things that we're analyzing with regard to our own public health department. But right now, I'll say the county's in the process of analyzing a potential Douglas County Health Department budget for 2023 after our IGA with Tri-County Health expires. And we're gathering that information from multiple sources, including we reviewed Tri-County Health's budget and overview document, both of which are available online. We worked with one of our consultants, Colorado Health Institute, on preliminary data about the state and federal funding sources that come through the Colorado Department of Public Health and Environment that may be attributable to Douglas County's population and service delivery priorities. In other words, all public health departments receive state and federal revenue in addition to the local per capita funding, and there's no reason to think that Douglas County would not have access to some of that state and federal revenue. We're looking at service utilization of all programs, how Douglas County residents have been using programs under Tri-County Health, and again, that's all in that overview document, if anybody's interested in taking a look at that. We're reviewing all the purchase orders and contracts that are currently in place between Tri-County Health and the Colorado Department of Public Health and Environment to determine funding for the grant cycles and kind of what the cycle is, when we would have to apply state per capita funding. There is also some American Rescue Plan short-term funding that may be available to us for a couple of years. We're also doing a cost analysis of absorbing administrative functions into our existing county departments. In other words, right now, Tri-County has its own human resources, IT, finance, facilities, et cetera, and we're looking at the cost savings associated with bringing all those in-house into our existing infrastructure. We're also doing a cost analysis of absorbing or combining coordinated programmatic functions with other county departments, and examples of that include Human Services and the Women, Infant, Children, commonly known as WIC program, Nurse Family Visitation. We have a Douglas County Mental Health Initiative that is ready to take on some of the suicide prevention and community health promotion of mental health and physical health efforts that are currently being provided by public health. We have our community development folks that provide what are called social determinants of health, basic needs that people have around housing and food that public health refers people to. And we have a youth initiative that can take a look at youth substance use disorder and high-risk behaviors that are also things being worked on currently under our public health. So we think there's some real cost analysis of combining efforts with existing things that we do as a county. And lastly, we are also getting input from our new Board of Health and from our Public Health Advisory Committee about what public health services they want to see prioritized in Douglas County based on a number of different ways that we're determining, what our county needs are, and then the funding will really be tied to those prioritized areas of service.
Yeah, and I think Barbara Drake is so awesome. That was amazing. Good information. And I will say, from the viewpoint of a Board of Douglas County Commissioner standpoint, the answer to the question is not a penny more than we're currently paying. So we have already contracted for services with Tri-County Health through the rest of this year and next year. So there will not be a single additional penny that Douglas County will be paying for public health services to Tri-County Health for the foreseeable future. I'm really happy to report that this county has virtually zero debt. Our sales tax revenue is up about 23%. We have very healthy reserves and have really tried to plan thoughtfully and conservatively around our budgeting process. So just from a commissioner standpoint, I'm really confident that we can afford it. The good news is probably not a dime until 2023, an additional dime.
All right, great question so far. Next is a question online from Ed for Commissioner Thomas. Ed writes, can you please provide context? I have private insurance. What is Douglas County Public Health, and what are the mission and deliverables?
Ed, I am so happy to hear that question asked right off the bat, because we have been inundated with questions from people thinking that because Douglas County is starting a Douglas County Health Department, that people are going to lose their private health insurance, that they're no longer going to have their Medicare and their Medicaid. And that's just absolutely not correct. And that's one of the reasons we're glad that everyone's listening tonight, so we can explain that the Douglas County Public Health Department is about public health. Public health is about the community's health. There are services like inspections to restaurants and septic systems, hair salons, nail salons, tattoo salons. The health department provides information on vital statistics from birth and death certificates They provide family planning in the form of free condoms and services for other birth control methods. They monitor infectious disease like hepatitis and tuberculosis and COVID. So there are a lot of public health services that the public health department will provide, but it has nothing to do with your private health care. So if you have a sore throat, you will continue to go to the doctor that you've always gone to. So nothing in the public health realm is going to affect either your Medicaid, your Medicare, or your private health care. Thank you, Ed, for that important question.
All right, next let's go to Diane on the phones. Diane, you're live. Go ahead. Diane, you are live on the phone line. Go ahead with your question.
Yes. Hello.
Go ahead.
Oh, as a physician, I'd like to know what type of personnel will be running your new health department, such as what kind of medical personnel will be involved with some of these decisions regarding the county's health.
This is Commissioner Teal. A lot of that is prescribed by law. Namely, we know that if we hire a public health director, we have an option to have a medical doctor or a DO running the entire department. If, however, we don't do that and we go with somebody who has, let's say, is trained as a nurse, somebody with a master's degree, then we must have a medical director who actually is a medical doctor or a DO to advise the new public health department. Beyond that, we are aware that Tri-County has nursing services for nutritional health and other needs. If that, based upon the community health assessment and the public health improvement plan, if we pursue those services and staff them, we will staff them with the properly accredited medical personnel. I don't know, Barbara, if that's something you want to say, or Tom, if that's something that you can provide some context organizationally to.
The only thing I would add is that our Board of Health has approved our Human Resources Department to begin a search for a public health director, which is the first step, and then followed by a medical director and additional public health staff or contracting for public health services or some hybrid of the two. And I'll turn it over to Tom.
Yeah, I mean, a public health agency is a pretty complex animal with lots of staff and lots of expertise in various areas. And, again, based on your community health assessment, you'll be able to tune that. But generally speaking, environmental health staff are science-trained biologists, environmental health specialists, and they have environmental health degrees or wildlife management degrees or various things like that. You've got a cadre of nurses and associated medical personnel for certain programs. You've got registered dietitians that work with the WIC program, for example, and mothers who are having, baby feeding issues and those kind of things. So it's a lot of things that have to work together, and I think as the process evolves over the next year or two, you can get a really good feeling for what the community really needs, and then there's a good circulation of professionals in Colorado that do those jobs well.
All right, thank you. As you heard earlier, this is like the 30th town hall the commissioners have held, and a new component is people are in person in the hearing room. So if you're listening in the hearing room and would like to ask a question, just raise your hand. We'll get a microphone over to you, and we're going to go to some in-person questions here in just a couple of minutes. But first, we're going to take an online question to Barbara from Amy. Amy asks, there were several meetings a few weeks ago to discuss the results of the survey sent out by the county. What is the county doing with these results and those from those smaller meetings? And when will those results be published?
Okay, good question. So what's being referred to is we have two things that are going on right now. One is a community health assessment that we actually issued an RFP for last spring and picked Health Management Associates to conduct this process for us, and that is ongoing. We expect the results of the survey, individual community meetings, and there was also a town hall. And there's also a component where Health Management Associates gathers important health data from a variety of sources about the health of our community and puts that all together in a community health assessment that will go to our Board of County Commissioners and our Board of Health. Likely, we'll have those finalized results at the end of October, early November. And from that, the Board of Health will then direct us to develop a public health improvement plan that's designed to address the findings in that assessment and then go from there. Both of these procedures are actually required under the 2008 Public Health Statute, and they kind of give us a head start, if you will, in starting a new health department. Our new Public Health Director, our new Board of Health may decide just to take all this data and build on it, enhance it, do another assessment in the future. But it is one thing that allows us to get a more kind of global and independent look at what our community thinks are the top sort of public health risks, the top kinds of public health needs. And I'd like to comment that our survey, and it was out for a very short time, and we have kind of a short turnaround on this because we wanted to have results by the end of the year. We had over 4,600 valid responses to our survey. And when Tri-County Health developed their community health assessment back in 2018 for their public health improvement plan that had a lifespan of 2019 to 2024, they had 399 survey responses. We have had 4,600 plus survey responses, and we have also had community meetings all over our county. We also have a community meeting coming up with the business community to understand their perspective about public health, and we also have a community meeting for Spanish-speaking members of our community. So we hope to have preliminary results from the community health assessment in the end of October, which is right around the corner, or early November, and all the work finalized by the end of this calendar year.
All right, thank you, Barbara. Definitely some impressive numbers there. A lot to be proud of. Just as a reminder, if you would like to ask a question live and you're on the phone, press *3. If you'd like to send a question through the web, that is douglas.co.us/townhall. And next is a question for Commissioner Teal from Parker Mayor Jeff Torberg. Here's what the mayor asked. Can you talk to any financial impacts on the municipalities in Douglas County? Will cities and towns be expected to contribute directly to the Douglas County Health Department?
At this time, there are no plans to there's no plans to ask the cities or the towns to contribute. We look at this as it has been with Tri-County, where it is county revenue that is the source to provide for public health services. So just as no town in the last recent years, in my 6.5 years on the Castle Rock Town Council, we never approved a check being cut straight to Tri-County because it was always a county service. Our plans right now is to maintain it as a county service and not to put that financial burden on the towns or cities of Douglas County.
All right, thank you. Let's go to the phone line for a question from Ann next. Go ahead, Ann.
Hello. In past meetings, there's been some talk about mental health crisis, dealing with it, such as suicide. And my question is there any plans to have mental health services to help maintain people long before the crisis?
Talk about the Douglas County Mental Health Initiative. In 2014, when I was the coroner, we had a really sad murder-suicide with a mentally ill young man who had fallen through the cracks. We were trying to get him help. and it didn't work the way it was supposed to. He took his mother's life, and then he took his own life. After that, Douglas County decided we needed to do better, and it took us about 3 years. But in May of 2017, through the really great guidance of Barbara Drake, we started our first co-responder team in May of 2017. That's a specially trained law enforcement officer with a PhD level clinician, and they would be responding to calls that had a mental health component to it. That team has been so successful that we now have 3 teams in the community and 1 team specially dedicated to children in schools. We saw a video one time of a little 8-year-old in a school counseling room that had lost control and threw the conference table over, and it was just so compelling to see that we needed to get help in our schools for our children. So now we have 4 community response teams in the field. We have some ARPA money coming along. That's American Rescue Plan Act money. I'm hoping that this board will commit more of those dollars to get more teams in the field. We also have another program called a Care Compact. We have found that when there is a person who has mental health needs, they don't need help in just one area. They need help in several areas. We have over 40 partners in our mental health initiative. And so we find that if we figure out what help this one individual needs, and we staff that person through our Care Compact, that they are not needing to call for help as regularly, they are more successful in becoming well, as well as the support around them. So that's a good question to ask. We will continue to grow our mental health initiative because we know it's working. We had less suicides in 2019 than we had in 2018. We had less suicides in 2020 than we had in 2019. And the coroner told us this year that there are less suicides to date than there were last year. That's how we know that our mental health initiative program is working.
So Roger, I don't know if you can hear me. I hope you can. We're about halfway through our program, and we've got a lot of wonderful people that have spent the time to be here with us in person tonight. So I'd love to open it up and give you guys an opportunity to ask any question on your minds. Who has a question for us? Yeah. This should be on. There you go.
I hope you might be able to indulge me because I got 2 because of something you brought up real quick that I just heard. You said that the Tri-County Health Department, we're going to pay exactly what we've been paying for the next 2 years, and we won't pay one more penny. My question on that, though, is isn't the intergovernmental agreement say that we'll pay up to $360,000 more for the costs of having to withdraw? And then we're talking about hiring a public health director who has to be a physician at one point. And I can't imagine someone like that wouldn't cost at least $250,000 a year in salary or benefits. So just in those 2 points that I'm aware of, we're already talking $800,000 to $900,000 in 2 years. So how can you possibly say it's not one more penny in the next 2 years?
Well, there's a good answer to that. Hopefully, you can hang on to that if you'd like. I think that's a really good question. So one of the nice things that we discovered, a bit of an epiphany, is that we can avail ourselves of the same state and federal grants that Tri-County Health can receive. So we currently pay $2.5 million on an annual basis to Tri-County Health for those services, but we're benefiting from a lot of grants that they currently receive as a health department. I'm sure, and I'll turn it over to Barbara Drake to share more about that, but in terms of resources that would come external to the county, there's a significant chunk. Barbara, I don't know if you want to add some additional.
So I had kind of outlined all the areas that we're looking at in terms of what that budget might look like. I will say that the commitment to Tri-County Health for per capita funding is an annual request, and that will flow into 2022. We have set aside some small amount of funding to fund transitional services, and that is money that we have in our budget and will not represent any kind of an increase to our taxpayers.
We'll add, we have zero intent to increase taxes in this county, zero. No need to do it. We're not going to do it. But good question. Who else?
Well, could I follow up that second one?
Sure.
Like I said,
yeah,
you
please.
prompted me with that one. So just another quick question, because as we all know, the mask issue has been bitterly fought over. But I had concerns that if two of the members that had been appointed by the Douglas County Commissioners, the Tri-County Health Department, were run out of their positions because of their views on masks. And then when we pulled out, within 24 hours, we had a decision of 5-0 by the Douglas County Board of Health, where there isn't a single dissenting voice. How can we possibly have any confidence in the Board of Health when it's clear that there is no dissent? Where at least with Tri-County, it was a 6-3 vote and a 5-4 vote.
Who wants to take that?
Well, I'll just say that this board, the three commissioners, don't always vote 3-0. That's why there is that opportunity. And I imagine there will be times as we go forward with the Board of Health that there will be differences. But what's really important is that we're all looking in the same direction, and we are looking to how. I'm not sure you like that answer.
Well, you say go in the same direction. That's like no tolerance dissent, in my mind.
Well, what I'm saying is that we are committed to have a Board of Health that provides the public health services that are required. And we have a very different demographic than Adams County does. And are you suggesting that Adams County Board of Health is going to have divided votes?
Well, I assume there'll be divided votes at some point on serious issues like masking. You know, we know not everyone agrees. That's why we're sitting here today. But when you have a Board of Health that goes 5-0 lockstep, you know, that is concerning to me, that there wasn't one dissent. There was no talking of dissent. It was like, this is what we're going to do, 5-0, understand, in our Board of Health.
I don't think there's any question that the current Board of Health
I thought I'd jump in. We're not hearing some of the discussion. Make sure you have your microphone in hand. And then let's finish this question up, and we've got some folks on the line ready to go.
Yeah, I don't think there's any question that the current Board of Health shares a number of views. During the course of creating the Public Health Department, however, I guess I actually do share some of your concern that there will not be vigorous discussion. There will not be discussion that creates that better department. I, for one, am very committed to making sure we do have broad and open discussion on the Board of Health. Obviously, at the formation time, it's probably pretty predictable that we do have overwhelming consensus, unanimity. That may not keep going. You know, we do have medical personnel that are a part of the Board of Health. We have Commissioner Thomas and myself that are on it. And then we have an expert in President Benevento, whom, you know, ran the Colorado Department of Environment and Health and Environment. So I share your concerns about, is unanimity a sign of groupthink? I, for one, am committed to making sure that, no, we have free and open discussion as we move forward, because this is only the start. This is the first 5 minutes of the football game. There's a long process to go through and a detailed process to go through. But I appreciate you bringing your concerns to light.
Yeah, and I'll just add, so, you know, after, 18, 19 months of trying to navigate COVID public policy on a local level, I'm committed to an apolitical discussion that is focused on the facts. So if you just look at this graph back here, October 17, 2021, you know, we really have 0 people, 6 to 11, 0 to 5, or 12 to 17, hospitalized in all of Douglas County, right? We also have the highest vaccination rate of any county in the Tri-County area. We're the healthiest county in the entire United States, over 20,000. So we're different. And I think that our demographics reflect that, and the people that are on this board also reflect those interests. I'm not interested in being governed by Adams County and Arapahoe. You may be. I'm not. And I'm really glad that this board is moving forward in a positive direction. Roger, let me, just because there are people here present, who else in the room has comments, thoughts? Yes, sir. James Poplovsky? Oh, man, we're getting close. We're getting close. Here you go.
Thank you. So I guess the first point is a lot of the discussions happening with our public health board happened before those red, orange, and blues came on there. So since we've withdrawn, we've had 10 under 17 and under hospitalized. So that's definitely a concern. So I guess one question I have is, when would we consider masking in schools? Do we need 20 kids in the hospital or 40? What is that metric? You did mention Mr. Benevento. Concern I had is he referenced the article in the Atlantic, basically confirmation bias, as you could say it. Find an article on the internet that sounded good to me. So very concerning that it was referencing Vinay Prasad. Didn't know the gender of the male that wrote the article, so that was concerning. He also, in that public health order, sorry, I'm a little nervous. In that public health order, it referenced the article saying masking wasn't beneficial or statistically significant, but the discussion and the consensus on that article basically said mask and improve ventilation. And so we looked at one sentence out of an entire 7-page scientific study, and we chose that one to base our policy. So I guess that would be a comment or concern, and I guess this is contentious. I'm independent. I voted for 2 of the commissioners on the board. I don't think I was here in time to vote for one of you guys. I vote pretty much on issues, and right now it's not voting well for the safety of my kids. And so I guess how do we unify our county, given the first order was just controversial and, as this gentleman said, rubber stamped?
I really respect that question, and I also respect the fact that James consistently shows up with a good question and tries to reference accurate studies. And I think you come from a really good place, so I appreciate that. I think from our perspective, we are deeply, deeply passionate about the health of your kids and every kid in this county. My kids too, I've got 3, and one is 3 years old and is unvaccinated. And so I have to step back and say, as a dad, as a commissioner, am I impacting the health of young people? I had a woman actually masked outdoors say, hey, you're killing thousands of kids. My response to that was, thank you for the comment, appreciate your input. We have had 1 child, 0 to 18, pass away throughout 18 months. Now, like I've said before, and you referenced this, that's 1 too many. We don't want any child to die. But when we think about the statistics and the statistical likelihood of hospitalization and death and bifurcate between severity and just cases, we have to make decisions that reflect the whole populace, our economy, our jobs, things that are significant to everybody, including you, I would think. And let me give our panelists a chance to, I'm walking out here. You guys probably have more to say on this. Let me hand the mic back to you, James. Thanks.
Just to follow up to that, those statistics were with masking. So we've just pulled those off, and I'm hoping it keeps trending down. But as many people have said, hope is not a strategy.
Thanks. Anybody else on the panel?
I think for me it comes down to the idea of, we look at these numbers, and we're often looking at single digits when there are 6 digits of children that are in schools right now. And I like to think of myself as a student of history. And I like to hearken back to the Black Death in Europe, where 1 of 5 people died. You go to the Spanish flu a century ago, and it was 1 in 100 who died, and so many more sick. The profile that these numbers say is that it's not our children that are susceptible and vulnerable. It's, the other segments of our society. The elder members of our society are very vulnerable, and we need to attend to their public health. But then I think it's excessive to throw it on all of our children as well, when we have data that says the severity just isn't there. The transmission probably is, but the severity just isn't. And so then, is it okay to mask the entire population of students? For me, that risk analysis comes out as a no. It's not worth it. And so you speak of unity. Well, then, let this be the unity. again, we have more people dying, and we have more people hospitalized
here
through
to keep it.
automobile accidents. And so, do we just stop driving? And so, do we do 38,000 a year? Do we just stop driving? So, obviously, Roger wants to keep us moving along, and obviously, this is something I've thought a great deal about, and I'm happy to talk to you about.
Okay, sorry to interrupt. We've got hundreds of people on the line, and we got a whole list of questions still coming in online. So just wanted to try to give those folks an equal chance. If you're still in the hearing room and have a question, raise your hand. We'll try to get back to you here in just a few minutes. Let's go to George, who's been waiting patiently on the phone. George, go ahead.
Hello, I'm George Melvin. I'm Sprucewood, and I'm just wondering, are we still going to be using CDPHE for our water test for our restaurants, and is Douglas County going to do the inspections of the restaurants, and how's that going to work? Thank you.
Is a kind of a resource for many, many local health departments, and setting up a local lab would be one of those expensive things with probably not a good return on the investment. So the state lab will continue to be the source of water quality testing and other things like that. Inspections certainly would be done by the future Douglas County Health Department by environmental health professionals.
All right, here's an online question for Barbara from Eric. Eric asks, what is the cost of the consulting groups being used for this effort, and where are the funds coming from to pay those groups?
Good question. I can remember the costs. Okay, so we have three major consultants that we have contracted with, and these costs are coming from the county's general fund. And they are really part of a months and months effort on our part to explore the options and opportunities associated with standing up our own health department. And we've actually been working on this for well over a year, long before a decision was made by the commissioners, just to begin to understand options and opportunities. So the first contractor is HMA, Health Management Associates, that's conducting the community health assessment and assisting the county to produce a public health improvement plan. I had mentioned that's a requirement under the statute and will really give us very good information. That process was done through an RFP, and I want to try to remember the exact amount. I believe is $144,700 for all of their work. In addition to that, we are contracting with Tom Butts from Colorado Environmental Public Health Services, LLC, for his incredible knowledge in environmental health, emergency management, and just all things public health administration. And that is an up to contract amount of $35,000. And we're also contracting with Colorado Health Institute, and they are assisting us in developing a roadmap for the transition to an independent local public health agency, including helping us prioritize high, medium, and low-value programs and services as it relates to what services under the district health department that our residents have actually been using. And also they're assisting with our financial analysis of what state, federal funding will be available to Douglas County Public Health. And that contract is, and I'm a slight estimate, but I want to say that contract is an up to amount, and these contracts are based on actual billable hours, actual work performed, and that contract is, I want to say $80,500 maximum.
All right, thank you.
I would just say that, I would just add that we felt it was really important to bring this kind of independent voice, if you will, from these consultants and to do this community health assessment so that we were really reaching out to a wide range of people in our community and accessing the expertise of people like Tom and Colorado Health Institute that are really bring a level, frankly, of neutrality and a level of a kind of robust point of view from lots of different voices in our community, and we felt like there was great value in in doing that as part of our analysis process to inform both our county commissioners in their decision and to assist our Board of Health in understanding what our public health department needs to look like. So I'd say we felt like it was money well spent to get that kind of neutrality and broad base of information for us.
And
All right.
I would add too, I don't know if you can hear, Roger, but it's an offsetting differential, because when you think about the FTE analysis, I mean, we found out that they are using 71 people in Tri-County Health for COVID services. The analysis provided by our experts, I think, has already informed a bit of that, and I'm fairly certain that this Board of Health would not employ 71 people in the same way or at that level to provide COVID services. We also know that they have about 23 people in their finance department, where we would have probably 3 to 4. So we run lean and mean in Douglas County, and you think about the cost of every FTE for current public health services, what we're paying for these professionals, I think, will result in a cost savings. Anybody else? We got somebody in the room here. Miles, yes? You bet.
Hi, yeah, Tri-County Health is remarkably bloated, but I would actually like to commend the Board of Health for their unanimous vote on this first issue, because I think it speaks to you all being reasonable and you all looking to the data. The data is overwhelming that masking does not make a statistically significant difference in the schools. It results in using the CDC and CDPHE's own data, results in 1.2 new cases per week in a school of 3,000, which results in a hospitalization every 2.3 years and a new incremental death every 300 years. So I think the unanimity on this particular issue is fantastic. But my question is this: with that being the data and those being the statistics, how does the Board of Health intend to educate the larger community and the politically driven Douglas County School District so that we can begin uniting our county and our kids and our schools and our teachers around the facts and around an issue that's been a very divisive issue? I hope that if we all look at the data and the facts, that we can begin, uniting around this.
The transition.
All right, let's take a question from...
And maybe we can... The transition we've had with schools, daycares, businesses here in Douglas County with the public health order has largely been seamless. Yes, we have had some instances where we have been informed that people were not educated on this, and so they were making a decision in their school, in their daycare. Really, all it took was some phone calls, a little bit of education, a request to voluntarily comply, and we've had compliance. So it's been pretty seamless. I don't feel like this has been something that has been forced by the county so much as something that people have wanted to do anyhow. And the Board of Health gave that opportunity.
All right, let's...
We have some folks online.
That came in. Yep, we've got a question that came in on Facebook from Frank. He asked, is the position of board member on the Douglas County Health Board a paid position?
Douglas County Board of Health, they are all volunteers.
Yeah, I was going to answer it as, unfortunately, no.
There you go. Thank you.
Quite frankly, there's, as far as we know, and we've kind of asked around, there are no compensated Board of Health members in the state of Colorado. There may be other states where that's a common practice, but here in Colorado, that is not a common practice. So, no, we are not receiving additional compensation to be a member of the Board of Health.
Commissioner Layton said it a minute ago, lean and mean in Douglas County. Let's go to the phone lines with Mark. He's got a question. Mark, go ahead.
Hi, yeah, Mark Montano here. And just wanted to know the plan for backing out our county commissioners who were appointed to the board. Yeah, I think there's this sense that the foxes guarding the hen house, and what is the plan to remove them and replace them with other community members who would sit on the board, just to prevent that appearance of impropriety where we have our hand in too many things. I would feel better if we didn't have that political portion of it in the county, in our county health board.
To thank you for that question. In many counties, the Board of County Commissioners is also the complete Board of Health. So having county commissioners serve on the Board of Health is not something unusual or unheard of. And I'm not aware that we have any plans for either Commissioner Teal or myself to back off of the Board of Health.
Yeah. When we were talking about forming the Board of Health, we actually had an awful lot of discussion about what should be the size, what is the correct composition, how many commissioners should we have. Obviously, we started with 5. The law very easily allows us to grow the Board of Health to a larger body, if need be. And actually, the law does allow us to remove county commissioners in the future as an appointment. Right now, though, the resolution that created it here in Douglas County does have two board of commissioners members on the Board of Health.
All right, we are just about out of time. We have time for one more question that came in online, and that is from Allison. Allison asks, will you guarantee that all the same services will still be available to Douglas County residents? Is there any chance that some services may not be available which were previously offered through Tri-County?
Again, first of all, let me say that by committing to stand up its own public health department, Douglas County understands the responsibilities of a public health department to Douglas County residents, and that means providing what are called core public health services and essential public health services. And all of these services are actually detailed in the Colorado Code of Regulations, 1014-7, and so you can look them up if you're interested. I will say, however, that there are some services that were being provided by Tri-County for the 3 counties that had very low utilization in Douglas County. In some cases, 1 or 2 residents were receiving. Now, some of those were small grants for very specialized programs. This is part of what we are looking at when I mentioned how we're arriving at budget figures and what grants we might be eligible for from CDPHE. So we are looking at prioritizing what we call high, moderate, and low value programs from the sense of what programs are Douglas County residents using at the highest levels. We know, for example, that environmental health services are highly utilized services by Douglas County businesses in particular. We see lower utilization in some other programs. We think we may be able to increase some of that utilization if we can market our own programs. One example of that is the WIC program for women, infants, and children. We think we can reach out to more people through our Human Services Department and combine efforts to actually increase utilization of that program. But there are some programs that have not really been designed or really have applied to Douglas County residents. And so we would look at those being what we call low-value programs for Douglas County, and would probably not apply for that funding or bring those on initially as we're building our health department. We really will go after the programs that you all tell us you want in the community health assessment and that have a higher rate of utilization by Douglas County residents. And we know that from Tri-County data.
Thank you, Barbara. We are close to the end of our call and town hall this evening. If we didn't get to your questions, we invite you to submit any question you may have about this or any other topic to douglas.co.us/citizen-connect at any time. Please be sure to join us for future town halls, and you can always visit douglas.co.us/town hall to sign up to ensure you are notified when we have our next call. We do have a couple calls coming up. Before we conclude tonight, I'd like to have your Douglas County Commissioners make a few final remarks and comments. Let's start with Commissioner Thomas. Go ahead.
Thank you. I'd like to thank everyone online and everybody in person here who wants to learn more about the Board of Health. We think this is going to be a very exciting opportunity to tailor-make a public health department for the residents here in Douglas County, very much like we are going to have our own judicial district, our own DA's office in 2025. We are growing and big enough that we can have our own services. I think in 5 years, people are going to look back and think, this is so wonderful. I wish we would have done this years ago. So stay tuned and keep engaged in our process. Thank you.
All right. Commissioner Teal, you're next. Go ahead.
All right. Well, thank you, Roger. Well, first and foremost, thanks everybody for coming. I definitely do appreciate the questions, the comments, critical, supportive, or otherwise. Personally, based on my 23 years in business, you never know where the next good idea is going to come from. And so, obviously, this is not a conversation that ends tonight. This is going to be a community conversation for the months, perhaps even years to come, as we do exactly what Commissioner Thomas talked about. We create a tailor-made service here in Douglas County, governed by the people of Douglas County, for the people of Douglas County. Again, thank you all so much for joining us this evening.
All right, thank you. And Commissioner Layton, you're up next.
Okay, well, thank you. And, I would echo my fellow commissioners' comments that this is my favorite, to hear directly from citizens, pro, con, people that hate it, people that love it. That's the way that we really distill to the best solutions for our entire community. But I will say, you've heard enough from me, and there was somebody in the room that raised their hand, so I will defer to this individual to share any comments.
Hi, thank you. My name's Tara. I've been here before. I've been at all of the Board of Health meetings that we've had so far, so I continue to appreciate how accessible you all are. I appreciate the conversations that you allow us to have in the room, even though there wasn't dissent in the ranks, which was refreshing to me, to be honest, after seeing a lot of stress at some Tri-County meetings. I especially really appreciated the comment that Mr. Benevento made during the last one, that the onus for mass decisions and mass masking of children belongs with the Board of Health. And for you to tell us and show us with data that that benefits our children would be a different conversation that we've had in the past, when these conversations have been had by the parents being brought to the Board of Health. So I really appreciate the change in opinion on that, and for you to be making those decisions and bringing it to the public. And so thank you for doing that. And then the only question I had was that if anybody had any comment on the upcoming election with numerous school board officials, hopefully changing hands for individuals, and any partnerships or relationships that you have that are impacting the Board of Health decisions or the county commissioner decisions. And I've spoken to lots of constituents that don't feel that they need to vote in that because they either don't have kids in the school district right now, or they're not sure how that might affect financial decisions in the county. So I was just wondering if anyone had any comment on that.
Not out of time, but I will say this board, I have seen them firsthand, both the Board of Health and certainly my Board of County Commissioners, and the decisions are apolitical. We do represent 357,000 people, and a lot of those people are students. They're young people, and you'd be surprised how much we do with the school district, whether it's providing resources for school security, talking about workforce development, or issues related to COVID. There's a lot of synergy there, so leadership there is important. Thank you, Roger.
Thank you very much. On behalf of Douglas County, thank you for sharing your evening and time with us tonight. We hope you will join us again for a future town hall. Be well, stay healthy, and have a good night.